What up guys, it's your boy Kevin Yee the PharmD, aka Kevin the Refugee, and today I have a special guest. I have Dr. Janice Burgos. Did I say Janice? I meant Janice. And for y'all that don't know, she's in the middle of her PGY1, and we talk about the reality and expectations of pursuing a residency. She gives great advice on time management, how to look for a residency, and seeing if a residency is for you. And at the end of the video, she also gives great advice whether you want to pursue residency or not. Honestly, I knew very little about her. I just slid in her DMs and she was down to do an interview. I really enjoyed this one, but yeah, I hope you guys enjoy it. Make sure you follow her. I'll put her info in the bottom and just enjoy the video. And if this video is too long for you, I have timestamps below, man. Take care. All right, perfect. 3, 2, 1, and we're live. What up guys, it's your boy Kevin Yee the PharmD, aka Kevin the Refugee, and today I have a mudda special guest. I have Dr. Janice Burgos, pharmacy resident. What's up? How you doing today?
Good. How are you?
I actually I've been meaning to do a reality versus expectations for like a residency and stuff like that. And I thought you'd be the perfect guest. And you know what's pretty funny about this interview? I actually know literally nothing about you. I just like slid in your DMs and just asked you to do this interview on the fly. So I think, yeah. So do you know what reality versus expectations is, by the way?
I've seen a couple of your videos. I think you did one on independent pharmacy and compounding pharmacy, so I glanced a little bit at that.
Yeah, I believe I did one on like informatics and a whole bunch of different things. But basically, for y'all that don't know what reality versus expectations is, all it is basically 5 things that she thought that her pharmacy residency would be like and what actually happened. So it can give you a better gauge of whether you want to pursue residency or not and whatnot. So, and dispel a lot of the rumors and whatnot. So I think it'll be really fun.
Yeah.
First of all, like what made you want to do, let's go back. Let's go into like the reasons why you did residency and all your like history and stuff. So what made you want to even do residency?
So I have a lot of experience in retail. I worked also at an independent pharmacy before, so I didn't really know much about clinical pharmacy going into it. After my P1 year, they gave me an opportunity as a student to do an observership program. So basically, I was at a local hospital for 6 weeks, and I got to shadow pharmacists both in the central pharmacy area where they fill the medicines for the patients, and then another 5 weeks of shadowing various clinical pharmacists in different roles such as infectious disease, cardiology, transplant. And then after seeing that interaction and just their dynamic with the medical team and the interventions they were able to make, I started becoming really interested in clinical pharmacy and going through a residency to get that position. And then I became really involved with SSHP, or the Student Society of Health System Pharmacists, which is kind of a local chapter of ASHP, which is the American Society of Health System Pharmacists. And through there, I was able to talk to different practitioners who were working as clinical pharmacists and seeing whether or not it was something that I thought I would want to go into.
How did you know it was for you? Like, I know you did a little bit of shadowing, but what was that experience like actually finding something that you actually were interested in?
Yeah, so before that, I guess I only thought I could be either a retail pharmacist where I worked before, an independent pharmacist, or working in the hospital just filling meds. I didn't really know that pharmacists could be part of a rounding service and working with physicians. And I'm the type of person, based on my personality, I really like talking to people face-to-face and doctors face-to-face, which is what I missed in retail, because you call them and then you'll make a recommendation. They're like, who are you? And why are you even making this recommendation in the first place? Whereas in hospital pharmacy, I noticed you work much closer with the physicians, and I really like that. I also like the aspect being able to see everything about a patient and being able to make more clinical recommendations, since you have their labs, you have their allergies, you have some of their old medical history, which you might not be able to have in retail pharmacy. So I really like that as well, and being able to use what I learned in school to help the patients that I'm serving. I
definitely feel that like more source of autonomy and like empowerment too, you know, because you have a lot more authority to do things. You're doing your PGY1 right now, right?
Yeah.
Since there's a whole bunch of different type of residencies, what type of residency are you doing right now?
So I'm doing what we call just a general practice PGY1 or postgraduate year one. So in a PGY1, they have you experience a variety of different rotations. It could depend on the hospital. So I work at a hospital that's very ICU and cardiology focused. And so those are two of our core rotations we have to do. And of course, you have infectious disease, internal medicine. So it's kind of getting a little bit of everything. I know there's other types of residencies like managed care, or there's some residency out there where you can specialize, such as a PGY1 specialized in pediatrics, or a PGY1 specialized in ambulatory care, where you have more rotations that are geared toward those specialties. But the one I'm in right now, which is probably the most common one out there, is just a general practice. So you can see a little bit of everything and see what you really like.
And now that you're you're almost done with your PGY1, right?
Yeah, I'm about 7 months in now.
Yeah. So are you planning to do PGY2 and all that as well?
So I actually decided to early commit to my program to do a solid organ transplant, PGY2.
Ooh.
So next year I'll be one of the PGY2 residents in solid organ transplant.
Dude, that's awesome. So let's jump into it. Let's do the reality versus expectations as planned. Like I said earlier, we're going to do 5 different things that Janice actually expected and what really happened. So Janice, what was your first expectation going into a PGY1?
So my first expectation, so as a student, you rotate and you have some experience with your APPEs in hospital pharmacy. And so as a student, I remember being so intimidated by the medical team, by the attendings, by the medical residents, and always talking to my preceptor and asking them questions because I was so scared to just make any interventions. And so I thought it would be very similar going into residency. And it was at first because you still had to build that rapport with the team. But I realized it is actually much easier to talk to medical residents than it seems, because they are doctors, so it can be intimidating, but there's also a lot they're still learning. So they're learning just like you are because they're residents, and there's a lot of things that they don't know that as a pharmacist or as a pharmacy resident that you can help them with. And so I've been able to make really good relationships actually with all the medical residents that I've been on service with. And so I have all their phone numbers, and I tell them they can always text me. So they text me if they have a question about a patient, or if I have something that I want to intervene on. It's much easier to tell the medical resident instead of trying to find the attending on the floor, trying to make a recommendation to the attending. I kind of just bypass and go through the residency.
Yeah.
If I can do an intervention that way. And I've actually become friends with a couple of them as well, which I didn't really expect going into residency. And it's much easier to talk to them. And it's really nice with the medical residents when you have a team, because the attendings tend to teach as well. So whatever they're teaching the medical residents, you kind of get to listen in on as well. And you also get to learn a lot from the attending when you have residents on your team.
Yeah, it sounds like going into residency, you're kind of scared about like making recommendations. You thought it'd be really scary, and you wouldn't really have a voice. But it's really cool to see that you actually get to work on a team and develop those relationships too.
Yeah.
What kind of, like, as a pharmacist, like as a clinical pharmacist, what kind of things do you find yourself helping the residents with most?
So, of course, medical residents, they think very whole picture body. So they're trying to see what's wrong with the patient, what are their problems, and how can we fix them. So sometimes they're not as focused on some of the medications. So they'll put them on the right medication, but it might not be the right frequency or dose which is commonly seen actually with antibiotics. So they'll say, okay, this patient will need this antibiotic for this infection and at this dose, but they don't always look at their creatinine function if we need to adjust the dose. So that's probably the most common intervention that I do, is adjusting a dose for a patient based on their renal function or their age, or they don't always look at drug interactions either. So, they have that click fatigue. So you have all these alerts come up on the electronic medical record. Everybody just bypasses it. But some of them are clinically relevant. And so as a pharmacist, you can look through the profile and see that there's an interaction between some of the meds that sometimes the doctors don't see right away, or even recommending a lab be taken for a patient. For example, QTC prolongation, which you can see, with like amiodarone and levaquin. Sometimes, there hasn't been a level for like a month. So you probably should get one to see if we need to change therapy. So those are kind of the most common recommendations that I make.
What was your second thing, by the way?
My second thing is confidence. And so that kind of goes into line with being intimidated talking to the medical team. So as a student, you feel like you don't know anything. And even as a resident, you feel like you don't know anything, especially coming out of pharmacy school. Someone told me that when you graduate pharmacy school, that's when you think you know the most. And then when you start working, you realize how little you actually know. Yeah. Especially trying to incorporate what you learn in school, because what you learn in school doesn't always apply to real world.
Can you give an example about that? Like something every day that you experience?
Yeah, so one example, for example, we have our first line agents that can be used. So you're like, okay, I should always use, let me see. So I'm trying to think of a clinically relevant example. For MRSA, let's use vancomycin, for those infections. But things that you don't think about is, okay, we want to send the patient home now, but they still have an MRSA infection. We can't just send them home on a line with vancomycin being infused on them all the time and get home health to see them. Patients don't really like that. So you have to think of other alternatives like linezolid or something PO that can be taken. So making recommendations like that, or sometimes medications could be resistant. And so, a doctor might put them on whatever the first line drug is empirically, but of course, when cultures come back and you see resistance, you can recommend changing to a more appropriate agent, which is kind of, in school, you're kind of used to spitting out what you remember what the first line agents are. You're like, oh, there's second and third line agents, but you're like, those aren't important.
Yeah.
But in real world, sometimes you do have to use those, or especially, I think a big thing is drug allergies.
Yeah, especially with antibiotics.
Like patients might be allergic to penicillins or allergic to cephalosporin, so you might not be able to use the first line agents and think of, some weird alternatives for that patient if they can't use it. So those are kind of like the most common I can think of that you kind of have to be a little bit more creative.
Yeah.
And not just go by what the textbook says or go by what you learned in school per se. And so, confidence. So going to residency, I felt very unconfident in my skills, and that's actually one reason why I went into residency, is trying to become more confident.
Ooh, that's interesting.
Yeah, gain that knowledge, because I felt like if I went straight into work, something bad was going to happen to one of my patients because I didn't know what I was doing.
Yeah.
So I really wanted to be being a resident's nice because you're kind of an in-between. So you're independent because you have your license, you can verify orders, you're a pharmacist, but you still have a preceptor. So in a way, you're almost like a student because you can still run things by somebody and ask them for recommendations and some help. So that's really nice, I think. And one of the reasons I also considered going into residency. And so confidence, so it's nice looking back like 6 or 7 months ago when I first started. I remember staffing for the first time in the hospital pharmacy and only verifying like magnesium and potassium orders because I was so afraid to verify orders because I didn't know what to do. I didn't know what to look for. I was scared if I verified order, if something would happen to my patient. That would be my worst fear. Yeah. And so now I verify much more things than potassium and magnesium.
I hope you do.
Yeah, going through, and especially rotations help a lot because I've had my ICU rotation already. I've had infectious disease. I've had anticoagulation. So I've just gained so much more knowledge now, and I'm so much more confident in what to look for, what interactions to really know, what labs I should look at when verifying meds. So I feel like I'm more confident, and just hearing feedback from my preceptors helps a lot too. Because at the end of each rotation, we do kind of a sign-off where we talk to our preceptors, see what our strengths are in that rotation or what we can work on the rest of the year. And so it's nice to hear from your preceptors when they compare you to day one to the end of the rotation, how much you've improved or how much more you know now and how confident they are in your abilities to dose those certain medications. So I think I've gained a lot more confidence now. And I remember one of my preceptors told me, even during rotation, that I need to work on confidence because I know what I'm doing. I'm just not confident enough to bring it to the team. So I would always still ask my preceptor, hey, I want to make this recommendation. Does it sound okay? And after a while, he was like, stop asking me, just ask the attending during rounds because you've been asking me for 3 weeks and you're a resident. You should know. You should be able to do this. So I think after that, I'm so much more confident now calling doctors and not being afraid to defend my stance, because some doctors or some residents may not agree with what you want to recommend for your patient, even though you think it's what's best. And maybe it's not right because they know the patient more than you do, since you're kind of just looking at notes. You don't see the whole patient every day. But sometimes as a pharmacist, for example, one time I was working and there was a patient on vancomycin that was dosed very incorrectly for hemodialysis. So hemodialysis, it should be dosed on Monday, Wednesday, Fridays, or whatever days they get hemodialysis after that day. So it's not like an everyday dose, and this patient was on everyday dosing. And so I called the physician, I called the resident, and he just did not want to discontinue the order. He said, it's fine, I think it's correct. And so, it's easy to just back down and be like, oh, the doctor says it's okay, the doctor says that, but you also want to care for your patients and think about your patients first. And so, I knew that this dose isn't right and that there could be some consequences for the patient. So I just kept pushing, gave him some literature, some evidence of why we should change the dose. And eventually he agreed to change the dose as well. So things like that, I don't imagine myself doing 7 months ago. But now that I've gained experience and I've really taken ownership of my license, because another thing you think of is you could also lose your license if something happens if you verify an order and it's incorrect. And
Yeah.
So you really want to take that responsibility and care for your patient. So even if a doctor doesn't agree with you, but if you think it's right, I think it's very important to stand up for your decision, to give background information, and to really push your stance if you think it's a patient safety issue.
Wow, that was a lot. I was going to ask you, like, what are the best ways, like, as a new resident, like, what's the best way to build confidence? But you said a lot of different things. You said getting honest feedback from your preceptor, trusting in yourself, and knowing, like, when to pick your battles. And if you have to, like, send literature, send evidence and stuff too.
And I think experience too is a big thing. I think once you get experience, I mean, wherever you work at, whether it is retail or hospital, independence, you're going to feel inadequate when you first start working as a new grad. But sometimes some people will, not everybody. Some people will.
I 100% agree with that. I remember like my first days, like practicing community, and I was just like, I was a huge mess. Like, even though I've worked community pretty much like for a really long time, like it was really different being a pharmacist.
Yeah, it's different having your name on that medication order compared to having the pharmacist that you were working for under before.
Because not your license.
Yeah. And I think
their
it's
license.
more scary in retail because you have to really check what your technicians are doing. And because you can't always trust, what they typed in or what they put in the bottle. So you have to be very careful. I remember when working retail, it was, looking up to my pharmacist and how detail oriented they were.
Yeah. And it's like, I think a lot, like, especially with community, I feel like it's more of the soft skills that really push you forward, because as you get to work with someone, you get to know their strengths and weaknesses, just like how your preceptor kind of assessed you. But there's certain things where that, they're more a little error prone. So you just try to catch on to that a little better,
Yeah.
So that's number 2, confidence. What's number 3?
Number 3 is, I think, time management. You hear that in school, and you think in school you're able to manage time going, from undergrad to pharmacy school. You're trying to balance being well-rounded, whether that be leadership or community service, but still trying to make decent grades to pass pharmacy school or anything else that you're involved in outside of school. Coming out, especially me, I thought I had pretty good time management skills.
Yeah.
I keep a calendar, I keep a planner, I'm on top of my deadlines. But residency really is a different world with time management skills, because not only do you have, your patients to work up, meetings with your preceptors, but you also have research projects you have to work on. Sometimes you have to teach lectures for certain colleges of pharmacy, or you have to help, like for us right now, we're help with interview sessions. And so you really have to be on top of your deadlines. We do a lot of presentations at some of the clinical meetings that we have to prepare for. And then you have to also be flexible, I think, because like random things happen and you just have to roll with it. For example, if a code happens, you have to drop everything that you're doing and go to that code. Or you might have your preceptor or the manager ask you if you can pick something up. And so you'll have to work on that on top of everything else that you have planned. So I think time management is a very needed skill in residency, and making sure you're on top of all your deadlines, because it's not like pharmacy school where you have a syllabus and they're like, okay, these are your exams and you kind of study every so often to get ready for your final. In residency, depending on the program, they'll just tell you, okay, it's due at this time. So you have to make your own timeline of when to work on these things in order to finish everything by deadline. And it could be harder for some people compared to other people, depending on what your experiences are and how you manage your time in pharmacy school and what you're involved with before. But I think, time management is very hard, especially also trying to balance work and home life, trying to balance, still spending time with friends and still doing the things that are important to you, whether that be community service or going to the gym or anything else you're involved with. I think those are also things you have to consider when doing time management, because residency is important, but you also need to take care of yourself.
So like how often do you look at your schedule, or how do you balance everything out then?
Yeah, so our program itself actually gives us a calendar of all our deadlines for the year and when kind of the major projects are due. I have a daily schedule that I do depending on the rotation. And so I either work up patients and then I have a schedule for rounds and meetings for that rotation. And then I also have my personal planner where I write down kind of all the things going on in my life that I have to do. And then I have my Google Calendar, which kind of incorporates like my work email calendar and also some personal stuff. So I have a lot of calendars. And then I kind of color code my calendar too by importance. So all my hard deadlines and more important deadlines are in red. Things for family are in another color. And then other assignments for work I have in another color to help kind of balance those things out.
And how often I know you have a daily thing, but do you like look at goals and timelines on a weekly basis, monthly basis as well, or like?
Yeah, so I usually look every Sunday or every Saturday kind of to see what's happening the week ahead, what things I need to prepare for, whether it be topic discussions or a presentation I have to give. I'll give those a look. And at the beginning of every month, I look also to see what's coming up for that month, whether it be a hard deadline for a research project or things that we might need to submit for some of our clinical meetings. I look at those too.
Oh, cool. I know every single residency is different, but what's a rough estimate of how much time you spend on residency?
Yeah, so like either at work or doing stuff residency related?
Yeah. Like, what is the sense of time commitment, for a residency?
Yeah, so on average, people would probably say on average, in general, residency, you work about 60 to 80 hours a week. So whether that be physically at work or doing stuff at home. For me in a day, I'm usually at work, depending on the rotation, of course, and how early you have to round. I would say like 7 to 5 or 6:30 to 5. So that's about 10 hours, 11 hours a day that I'm here at work. And then sometimes I'm at home, reading as well, reading for articles or for topic discussions. So I would say probably I'll spend 12 to 13 hours a day doing like residency related stuff. And then on the weekends I work a little bit more those weeks as well. And then we also, at my program, we do evening shifts. And so we work until like 10 p.m. on those days. So those days are like 16 or 17 hours long.
Can you take me through a typical day for like a residency?
So usually in the morning, you come in, work up patients. So let's just say theoretically around at 8 o'clock.
Yeah.
So I come in, depending on how many patients you have. So I'll come in maybe at 6:30 or 7 o'clock to look at my patients, work them up, get ready for rounds. Maybe at the beginning of residency, you might meet with your preceptor 30 minutes before, so maybe 7:30. And then you'll round with your team at 8 o'clock to, let's say, lunchtime around or 11:30 around. And then sometimes during the lunch meetings, you'll have presentations either given by students, given by other residents, or other meetings you have to attend. So that might be until 1:30. And in the afternoon, it's really more of following up on your intervention, seeing if those were followed through or anything else you need to check up on or follow up on from rounds, topic discussions with your preceptors, meetings with your residency director, or working on your projects is mainly in the afternoon.
Yeah, that definitely gives a better sense of like the time commitment for like pursuing a residency and stuff. Let's see, we're on number 3. What's number 4? What's your 4th expectation?
Yeah, so that kind of goes back to what I was saying a little bit about time management is self-care. And so, especially in pharmacy school, I think I didn't spend a lot of time on self-care. I focused a lot on school, and I think that really, took a toll on my mental health and my physical health as well. So with residency, you would think that you would be even more committed and have no more time for yourself. But I think it's important, especially as you're kind of in a new phase of life, you're now working and this could be, the rest of your life. So you really need to set that foundation is to take care of yourself. And so you want to also avoid being burnt out, because I think a lot of people in residency could overwork themselves and easily get burnt out with the projects and the deadlines and the time commitment that residency entails. And so I think one thing that I didn't expect was making time for myself. So, me and my co-residents, we spend a lot of time together. So we go out for dinners, we go out and do different activities because we think it's very important to take care of ourselves during the residency, because when you're taken care of, then you can really take care of your patients, because I've learned that it's hard to really focus on your patients when you're not in a good state yourself. And so I think just for your patients' sake as well as your own sake, it's good to, still enjoy the things that you enjoy doing. Like for me, I've been taking like bar classes. So I take bar classes every week. And
what are bar classes?
So they're like gym classes which teach you kind of like weightlifting techniques and kind of increasing those stamina.
Yeah.
And then it's like there's music as well. So it's like going into music.
So it's like,
that's really fun.
It's basically like CrossFit with music.
Yeah, or like Soul Cycle with like weights.
Gotcha.
Yeah. So that's really fun. So I enjoy doing that. And, making time with friends as well, I think is really important. So I think self-care is another thing that I didn't expect to be focusing on residency, but I think it's also actually really essential.
Is that why you started your Instagram too?
Yeah, so I started my Instagram recently, so shameless plug.
Yeah.
My Instagram is dr.pharma.seuss. And so it's just an Instagram about my journey as a resident. And so I started it recently, actually, just as a side hobby because I also it's something I was interested in. And I remember when I first started applying for residency and looking for advice or things to look at, there wasn't really much out there like a year ago for things. There weren't like any really YouTube videos or any articles too much besides Student Doctor and what network. So I didn't really know where to look for, who to ask besides my friends. And so I thought it would be really neat to start an Instagram talking about some of the things about residency to see if this is something people would really enjoy. Because I knew I was looking for it when I was applying for residency. And so I really wanted to start that. And I think it's a nice side hobby to do, just to do something else aside from work, since I work so much.
Yeah, it's wicked fun. Actually, one of my friends, his name is Brian Fung. I'm not sure if you've seen his videos and stuff, but he's actually, this guy is an overachiever. He did his PGY1, PGY2. Now he's doing his MPH, so his name is going to be wicked long, board certified, everything. It's so crazy, and he specializes in informatics pharmacist, but I actually convinced him to start doing residency videos because that's kind of like the trending topic nowadays, in the pharmacy social media. So honestly, I think it's really great that you're giving a glimpse of that lifestyle because people truly are curious about it. And unfortunately for me, I never did residency, so I can't really help people out with that. But so yeah, that's awesome. So it sounds like fitness is really important to you. Do you like meditate or journal or do anything else like that?
Yeah, so I journal. So I have an adult coloring book. So I like to, meditate and just relax a little bit by, kind of just coloring and, thinking about my day. I also write notes for myself. So I like to reflect on my day, whether something good happened, something bad happened, and write a little note, especially the good things, because I think it's nice to look back on those when you have a bad day and kind of remember why you did a residency in the first place or why you did pharmacy school in the first place. I think it's easy to forget those things when you're struggling or going through things that are very difficult or very stressful. So I kind of like to write little notes in my day and kind of a small journal of what's happened and a summary because it's also nice to look back on at the end of the year.
Do you keep it like in a physical journal or do it online or anything like that?
Yeah, I used to try to do it online, and I realized it wasn't as satisfying for me.
Yeah.
I started handwriting it out into a journal.
Yeah. Back to planners and stuff. Do you use like a specific brand of like planners or something like that? Or like, do you use like a Moleskine notebook or do you use like Panda Planner or a certain planner or anything?
Yeah, so the planners I like, so I'm more of a weekly, monthly person. So I like the planners that have, the general month in the front so I can see what's happening, but I also like having the weekly aspect so you can write down those tasks for the day. Yeah. So I know some people get those really fancy Erin Cauldron planners. I just go to Target and buy a weekly, monthly planner that I like.
Yeah.
And the style that I like.
One planner, well, the reason why I brought it up just now was because the planner I use, because I'm a pretty busy person, especially when I was working and stuff, like I was scheduling my work schedule, but I need to do my YouTube content and all this other stuff. And one of the things I love about my Panda planner is that every single day there's like gratitude, like it makes you write what you're grateful for and all this other stuff. So I would do that. And then I would also do like an online type of journal too, so yeah. So I get best of both worlds, but yeah,
that's pretty cool. I haven't heard of that planner, but I might look into it now.
Yeah, Panda Planner is like sick. I love that. It's like the #1 rated on Amazon and stuff.
Okay.
And then if you like colors and stuff, you can get those Japanese pens and stuff and start writing in it. But I like it because it's like, honestly, it feels good going into the day knowing like starting your day off right and knowing what you want to accomplish in the day and also going in with gratitude, Okay, so that's number 4. What's number 5?
So 5 is friendship. So So I am doing my residency in my hometown. So I still keep in touch with a lot of my friends here. But going into residency, so I have a very large residency class that has PGY1s and PGY2s here.
Okay.
So that's one of the criteria I actually had looking for residency is I wanted a large class. And so I knew that I would probably make friends with a few of them, but of course it kind of depends because you can't determine, who you match with at residency and whether or not you'll get along.
Yeah.
But me and my co-residents actually get along really, really well, both the PGY1s and the PGY2s. And so we go out every month for our birthdays. We try to do like a monthly hangout. We text each other all the time. And it's nice having co-residents because there are people going through the exact same thing that you're going through. So, your friends might not exactly understand your time commitment or understand some of the stress that you're going through. Also, even if you have friends at other hospitals, they might not be able to understand some of the internal problems that you might be going through at your own hospital, since it can also vary as well. So it's nice having other co-residents because you can kind of relate on the same level and you have people that will understand what you're going through, even with different rotations that you might be struggling with. So I was really surprised. I'm very good friends with all my co-residents and we get along really well. And it just makes residency more enjoyable when you work with people that you like being around. So, some people might not like going into residency because you're like, oh, you work so early, you work so late. But with my co-residents, we're here at the same time in the morning, same time in the afternoon. And it's just fun spending time with each other. And we always joke around that we don't know if we're doing residency right because we laugh so much with each other. So we're like, oh, maybe we're doing something wrong and this isn't how we should be feeling. But it just makes work so much more enjoyable. And these past 7 months have gone by so fast. And I think a lot of it is due to the friendships I've made, not even with just my co-residents, but even some of my preceptors I've become friends with. And so that's been really fun as well, being able to get advice from them, but also just talk about life with them on what's going on and what concerts they're seeing and going out to dinners with them. So that's been really enjoyable as well.
That's awesome. For me, that's how I talk about a lot of my pharmacy friendships. Like the people I went to pharmacy school with, those are some of my most rewarding, best relationships. And a lot of them are like I consider them one of my best friends. And it goes more than just friends sometimes. Like, I don't know how often you see your family and stuff, but they almost become like your second family. And as you're describing, I'm like, oh man, I miss that, man.
Yeah, like so I went to pharmacy school away from home, and I feel, the same way that. Oops. Sorry, I totally just dropped my phone. You can edit that part out, but
it's staying in.
So I totally understand what you feel. I made really good friends in pharmacy school, and they're like my family too, since I wasn't able to see my family that much during pharmacy school. And so it's nice in residency, you kind of still have that same feeling, which I know I'm going to miss once I start actually like working out of residency.
Yeah, and it's different. Like, I know you're talking and stuff, but I feel like it's very different from your, I don't want to say regular friends, but kind of like friends that aren't going through the same stuff as you. You know what I mean? Because like they're supportive and stuff, but there's something about being in the fire together that really cultivates like really meaningful relationships and stuff. Those were the 5. So can you go over the 5 again? I can't remember that.
Yeah. So number 1 was just the positive interactions that you can have with your medical residents and medical team. Number 2 would be the confidence that you can build through residency, especially coming out of pharmacy school. Yeah. Number 3 would be just the amount of time management you really do need to do a residency. 4 would be self-care and taking care of yourself. And 5 would be the unexpected friendships you might make.
Yeah, and finally, I just want to ask you, like, let's say if a pharmacy student is watching this video, right, and they're looking for tips on residency, do you have any tips of finding the perfect residency or how to start the search or anything like that?
Yeah, so I think a really good place to start would be the ASHP website or the American Society of Health System Pharmacists. So they have, especially if you're a third year, they have a really good timeline of when you should be asking for, let's say, letter of recommendations, writing your letter of intent. It also has the deadlines for all of your programs because some of the deadlines may change or may be different compared to each other. Some are earlier and some are later. Another good resource would be mid-year. So every year in December, they have a conference called mid-year where several of the hospital pharmacies who have residencies go to that program to recruit. So it's a nice place for you to talk to programs, see what you like, what you're looking for. I think that's a really good resource to use. Like this past year, we had Michelle Obama as our keynote speaker, which is pretty cool. So that was really fun. And it was in Florida, and that was really fun. We got to go to like Universal Studios and Disney World for that conference. And really just, ask around, join your local societies of health system pharmacists if you have one, or some other clinical-based organizations that your school may have. Talk to people whether that be another resident, a clinical pharmacist, someone going through the process. I think it'll give you a lot of perspective whether or not this is something you want to do.
How did you find like that person to talk to? Did you do cold like LinkedIn things? Did you do what I did and slide into people's DMs? Like, how do you like get an opportunity to talk to them?
Yeah, so I think I mentioned before, I was really involved with Student Society of Health System Pharmacists in my school. And so they had different residents come in, so I got to talk to them. A lot of your preceptors or a lot of your professors probably also have affiliation maybe with a hospital, so they also teach at that hospital or round on that hospital while teaching school. So I think they're a great resource. A lot of our professors were also clinical faculty, so they gave us opportunities to shadow them at the hospital. So I think that's also a really great opportunities to reach out to your professors or deans to see if they know people in the area that you could talk to or shadow, especially in an area of interest you may have. For me, for transplant, I didn't know this was something I wanted to do until like P4 rotations, and I had a rotation in transplant. So it's kind of hard going through school to see especially what area you might like, because I don't even remember my transplant lecture that much in school. And so like I probably wouldn't have known this is what I wanted to do. But, in school it's kind of hard as a student, especially, depending on your professors you may have, you may not like a certain subject because of the way it was taught, but you may not necessarily not enjoy that subject. It might have just been the circumstances, and you might love it as a P4 during rotations. And so, it's really hard to determine your specialty. But as for, a general PGY1 residency, I think it's important to just reach out to people who are in those positions and even just shadow them for a day. I think would be very valuable to see if it's something you'd like to do. And it's the same thing with other professions, whether that be, in pharmaceutical industry or retail pharmacy, if you don't have experience there, or independent pharmacy. I think shadowing is a very invaluable experience that you need to really look into to see if this is something that you want to do.
Do you think there's this is something I've always been thinking. Do you think shadowing is really hard, especially dealing with all these like HIPAA laws and stuff like that as well?
Yeah, I think it can be difficult because you do have to do, education and do HIPAA signing. But at least in my area, a lot of the hospitals here are very open to having students come shadow and come see what a pharmacist does in a daily life. There's just some paperwork, and it might just take some time to process. So it's always better to ask early rather than later in the year to get that process started. I know when I was in pharmacy school as well, a lot of our professors were also very open, and their hospitals were very willing to have students come shadow. You just need to do, kind of all the paperwork. And so I think it can be a concern, but I think most places are pretty open to that idea with students.
Oh, that's awesome. Shoot, there was something else I want to ask. I can't remember. Oh yeah, so like, how you're saying like you really, really want to do transplant, right? Was there a specific moment where you just knew it was for you, or like how did you know that specific area is like something that you really wanted to do?
Yeah, so initially I actually thought I was going to go into ambulatory care, which is more, diabetes, chronic state management, and some people even have their own office where they can see their patients. So I thought that's what I wanted to do initially. But there's not too many ambulatory care residencies from where I'm from. And so I knew I would have to move away if I did an ambulatory care residency. And so someone had briefly mentioned to me, oh, you like ambulatory care, you might like transplant. And I knew nothing about transplant pharmacy at that point when they suggested it. And I even actually changed my rotations because I never had a transplant rotation when I started. I asked to be put in a transplant rotation like in February of my P4 year.
Oh, shoot.
It was really late when they added it on. I had it as my last rotation.
Yeah.
Because someone ended up dropping it. So I was like, okay. So then I started my transplant residency or my transplant rotation. And number one, I had an amazing preceptor who I got along with really well. So I think that, can also change your mind whether or not you have a good preceptor. And then two, it was cool seeing both an inpatient and outpatient perspective because you get both as a transplant pharmacist. So you round with your team and you see all these patients from the time they get their transplant all the way to the time they're discharged. And one of the most interesting things now is that CMS, or the Centers for Medicaid and Medicare Services, are now requiring a pharmacist to be on a transplant team for reimbursement. So, that opens up a ton of job opportunities too, because CMS is saying that because these patients are on so many new medications, that they want a pharmacist to discharge counsel these patients to make sure they understand. So, that's really awesome as well, because pharmacists are really getting a voice now in that field, which I really enjoy. And then, so I think it was just somehow throughout the rotation, I realized that I really like this field and being able to not see my patients on an outpatient basis, because I see them in clinic as well. So you also form those relationships with them, which I really like. And you get to see them over time, get to know their families, get to know who they are as people after the transplant. But you also get that inpatient side with rounding with medical teams, making interventions. And so I think I realized I really like both aspects, and that I would like that better than just being, solely outpatient. So I think it was just throughout my entire rotation that I realized that this was something I wanted to do. And as a resident, I did, a couple more transplant rotations to see, and then it just kind of kept solidifying my interest in transplant.
So you basically tested it as you went. That's awesome. Do you think there's I know you mentioned it a little bit earlier, but do you think is there a huge demand and low supply for those type of careers and stuff for that job?
Yeah, so for clinical specialist jobs?
Yeah, for things like transplant and whatnot.
Yeah, I think transplant specifically right now, before I think it was kind of at a standstill or very difficult, because I think in general it's hard to find a position as a clinical specialist, because each hospital probably only needs a few. You don't need like 20 transplant pharmacists if you don't do that many transplants. So the demand isn't too crazy high depending on the specialty. But now with the new CMS requirement, I think the demand is going to go up within the next couple years, but it's probably going to also plateau again, because a lot more programs are opening transplant residencies as well. And a lot of programs are opening, just general PGY2. So that means more people will be specialized, but there's not that many positions that are opening yet, depending on where you live.
I see.
Yeah. But right now, it's a great time to do a residency and do a clinical specialist job. I don't know how I'll look like in a couple years.
I don't think anybody's like Miss Cleo or anything can predict the future like that.
Yeah.
Finally, is there anything else let's say there's a student watching, is there any last words that you want to let them know or say anything that we missed during our talk?
Yeah, I mean, I think residency is great, but I also think if you think it's not for you, that's also great as well. I think you should really discover yourself and see what your strengths are, what you want to do as a future career, like what your 5 and 10-year goals are. So my goals were to become, a clinical specialist and all that stuff. But, your goals might be different. I think that's important to look into those and look into, what you want your family life to look like, what you want, things to look like in the future for you. And then if it's something that, maybe not, as seen, like maybe, there's a lot of IT pharmacists who are out there right now, which we don't see too often. There's a ton of pharmacy jobs that aren't very frequent, but I think if you set your mind to it, there's going to be an opportunity for you to do that, and you should really take any opportunity you get. So residency is great, but we also need community pharmacists. We need, independent pharmacists as well for our patients. So, just because you don't do a residency and your friends are doing residency, it doesn't mean that you're doing something wrong or that you should do residency because your school is pressuring you to, or that other people around you are pressuring you to do it. I think it's whatever you want to do in the future and what your interests are. You should really hone into those things and also your strengths.
That's really sound advice, because I feel like especially in the community pharmacy realm, I think a lot of us feel kind of not guilty, or maybe not, I don't want to say lesser, but a lot of us feel like kind of that pressure or that guilt of not pursuing a residency, right after school. So I think that's really sound advice, and that's amazing. Just curious, you were talking about 5-10 year plan. What do you imagine your life being 5 to 10 years from now?
Yeah, I remember having to write this for my residency program a year ago.
Yeah.
So, I mean, my 5-year plan right now is to hopefully, get a transplant job in the area that I'm working in. I'm not 100% sure like what area of transplant I want to go into. Right now I'm interested in kidney and lung transplant, so kind of just depends on the job availability there. I think my 10-year plan, or even further along, is I do want to work still in the more outpatient side, ambulatory care patient side. I think a lot of hospitals are going towards outpatient care for transplant pharmacists, and so I think that would be a really cool job to do, and be able to manage and help manage patient meds on an outpatient basis and not really rounding on the service so much. But as for immediate goals, I think I still have a lot to learn, a lot of things that I want to know about my patients, and so I think sticking to an inpatient outpatient setting is really nice for me to learn those things.
Yeah. And do you how do you imagine your family life like when you actually start having a family?
Yeah, I have no idea what I'm going to do when I start having a family and how I'm going to balance. I always say, like, I could barely manage my time right now, and I I don't have my own family. I'm not married, and I can barely figure out my life now. But I guess when that road comes, then we'll just go with it and see what to do. But I might at that point might start looking for a job in ambulatory care, just to kind of help with family life balance a little bit more. But a lot of my pharmacists here have small children and have a family, and they're able to balance that, and some of their spouses are also pharmacists, so they make it work. So I'll probably just ask them and be like, hey, how do you make this work for you, and how can I make this work for me? So I might be able to stay in the position I'm in now. I think I just have to figure out how to prioritize and what I really want to do for myself at that point. But that's a totally different life stage.
Yes, it is. Awesome. Okay, cool. So if you guys want to follow Janice, I'll put her IG and everything else that she wants to plug. Did you want anything other than your IG, by the way?
Nope, I don't have anything else.
Awesome. So yeah, you can follow her IG, follow her on her journey through residency and whatnot. And if you guys got any questions and stuff, feel free to leave them in the comments, and maybe we'll do a part 2 or something. But honestly, thank you so much for just coming in. It was the most randomest thing, because I just literally slid in your DM and I just asked you, hey, do you want to be on my channel? And you're really open to share all this information. And I think it's really great that you have all these experiences and you're able to just help other students and other people make a better decision for their future careers and stuff. So awesome. Appreciate it.
Yeah, thanks for having me. This is really fun.
Yeah, I know. It's supposed to be, right? But yeah, thank you. And don't forget, make sure to subscribe, like, and share this video if you think it's going to help anyone. Thank you, Janice. Take care.
Yeah, thanks, Kev.